My name is Stefanie Clark, and this is my Skills Demo 1 for the nursing assessment class. Okay, I'm going to start with a general survey by saying that Miles is a well-developed male. He is able to maintain eye contact during conversation. He has no acute signs of distress at this time. His nutrition is appropriate for his height and body stature, and he has active range of motion of all extremities. Okay, so Miles, I'm going to go ahead and start with the physical assessment portion of the exam. If you have any questions or concerns during the exam, just stop me and feel free to ask, okay?
Okay.
Okay, the first thing I'm going to do is just start with a general assessment of your skin. Now, do you have any complications? Do you have any lesions that you're worried of? Any pain, dryness?
No.
Any redness at all? Okay, can I see you right here? No toenails or fingernails that are causing you any pain at all?
No.
Alright. Okay. So now that I've done that, I'm going to go ahead and start with your head. Now, do you notice that you have any pain or any lesions, anything, any complications with your scalp?
Nope.
Okay. You don't have dandruff at all?
No.
Okay. Good. So now that I've done that, I'm going to go ahead and do some assessments with your face. So the first thing I want you to do for me is to smile, frown, puff your cheeks. Great. Now the next thing I'm going to ask you to do is close your eyes, and I'm going to try to resist opening your eyes by pushing up on your eyelids. I want you to try to keep them closed. So go ahead and close your eyes. Okay. Great. Now the next thing that I'm going to do, I'm asking you to clench your jaw. Good. So now what I'm going to do is a series of tests. The first one I'm going to do is test for pain sensation. So what I'm going to do is I'm going to ask you to close your eyes. I'm going to tap using my applicator on different places of your face, and I want you to tell me if it is a sharp or a dull sensation. Okay, so go ahead and close your eyes for me. Tell me if this is sharp or dull.
Sharp.
Sharp or dull.
Sharp.
Sharp or dull.
Sharp.
Sharp or dull.
Dull.
Sharp or dull.
Sharp.
Good. Okay, you can open your eyes. Now the next test I'm going to do, I'm still going to touch different places with your face with the applicator, but this time I'm going to be using a light touch. And I want you to close your eyes, and when I touch you, I want you to point to where I've touched you. Okay? So go ahead and close your eyes.
Yep.
Great. Okay, so go ahead and open your eyes. Next, I'm going to palpate the sinuses. I want you to tell me that you have any pain upon palpation, okay?
Okay.
Any pain or tenderness?
No.
Okay, and how about now?
No.
Good. Alright, so now that we've done that, I'm going to go ahead and move on to your eyes. So the first thing I'm just going to ask you, do you have any drainage from your eyes, any blurred vision, double vision, any complications at all?
Mm-mm.
Okay? Can you look up for me? Great. Now go ahead and stare straight at me. Great. Now that I've done that, I'm actually going to do some visual acuity testing. I want you to hold this chart about 14 inches from your face.
Okay.
Okay, cover your right eye for me. And read the smallest line that you can read.
63925.
Great. Now go ahead and switch. Cover your left eye. And I want you to read the smallest line that you can read, but this time read it backwards.
52936.
Okay, so go ahead and uncover both eyes and read the smallest line that you can read.
6395.
Good. All right. So now what I'm going to do is actually do some testing of the muscles of your eyes. So what I want you to do is stare straight at me, and I want you to maintain your head in a neutral position, but follow my finger with your gaze. Okay? Okay, stare straight at my finger for me. Good. So now, I'm going to do this next test. I want you just to stare straight at my nose for me, okay? Good. So now that we've done that, I'm actually going to do some testing with your ears. So for your right ear, do you know, or for your left ear, do you notice that you have any drainage, any hearing loss, any ringing in your ears, any pain when I palpate?
No.
Lesions or drainage at all?
Nope.
Okay. If you could tilt your head slightly to the side, and I'm just going to insert my otoscope and take a peek.
Okay.
Okay. Now how about the right ear? Do you have any pain? Anything you're concerned with, hearing loss, ringing in your ear, drainage at all?
No.
No lesions, and it doesn't hurt when I palpate?
No.
Okay, lean slightly to the side here. Great, okay. So next I'm going to do a series of hearing tests. The first one is called the Weber test. What I'm going to do is I'm going to activate the tuning fork, place it midline on your head. I want you to tell me if you can hear better in your right ear, your left ear, or hear in both ears. Okay?
Okay. Yeah, both.
Okay. So the next test I'm going to do is the Renee test. So for this test, what I'm going to do is I'm actually going to place the tuning fork in two different places. I'm going to place it behind your ear and beside. I want you to tell me if you hear it better behind or beside. Okay?
Okay. Yeah, beside.
Okay.
Beside.
Okay. So now I'm going to actually move on to your nose. Do you notice that you have any pain, any drainage, or any issues with your nose at all?
No.
Okay. Does it hurt when I palpate?
No.
Okay. Breathe through your nostril. And the other. Great. Now lean up and actually look up towards me. Great. Okay, now what I'm going to do is actually assess your sense of smell. So what I want you to do is close your eyes. I'm going to occlude one of your nostrils at a time, and I want you to tell me that if you can determine what the scent is that I'm holding to your nose. Okay? So
Okay.
go ahead and close your eyes for me. And tell me if you can determine the smell.
Mm-hmm. Coffee.
Coffee, exactly. Okay? So keep your eyes closed. And tell me this.
Cinnamon?
Yes. Good job. All right, so now that we've done your nose, I'm going to go ahead and move on to your mouth. Do you notice that you have any lesions on your lips, any soreness, okay? Inside your mouth, any sores, any missing teeth, loose teeth, any problems?
Nope.
Okay, I'm just going to assess the outside of your mouth. Great. Now if you could open your mouth and stick your tongue out for me. Good. Now I'm going to use my tongue depressor, and I'm just going to look at the different places and inspect your mouth, okay? So stick your tongue out for me. Okay, lift your tongue. Okay. Now, next what I want you to do is stick your tongue out for me and say, ah.
Ah.
Good. Okay, so I'm not going to activate your gag reflex, but if I was to do that, I would use my tongue depressor to tap the posterior wall, but I'm not going to do that right now.
Thank you.
So now that we have done the mouth, what I'm going to do is go ahead and move on to the lymph nodes. So I want you to tell me if you have any tenderness as I palpate the different places of your lymph nodes, okay?
Okay.
Okay, any pain?
Nope.
Okay, the next thing I want you to do is I want you to keep your head in a neutral position. I'm going to place my hands on either side of your head, and I want you to turn to resist my hands. First to the right, then to the left. Okay?
Okay.
Good. Great. Now shrug your shoulders. Okay, now I want you to actually tilt your chin up, and I want you to swallow. Okay, what I'm doing is I'm actually going to get my landmark, so I'm going to go ahead and do an assessment of your thyroid. So what I want you to do is lean your head slightly forward. Great, and just relax. Now swallow. Okay, now on the other side, go ahead and swallow for me. Great. Now what I want you to do is stand up, and I'm actually going to assess the posterior part of your thorax, okay?
Turn around.
Okay, and sit in the chair. Great. Now do you notice that you have any trouble breathing, any shortness of breath, or any complications?
Nope.
Okay, so take a big deep breath for me. Good. Okay, deep breath in with your mouth open, please. Great. Now do you have any pain when I palpate?
Nope.
All right. So the next thing I'm going to do is I'm actually going to place my hands in different positions on your back. As I touch you, I want you to repeat the phrase 99.
99.
Ready?
99. 99. 99. 99. 99. 99. 99. 99, 99, 99.
Great. Okay, so the next thing I'm going to do is I'm going to tap in different places of your back. I just want you to breathe normally.
Okay.
Great. Now what I'm going to do is I'm actually going to use my stethoscope to listen. What I want you to do is lean slightly forward, breathe deeply than you normally would with your mouth open. If you have any shortness, kind of dizziness or shortness of breath during, just raise your hand and we'll stop.
Okay.
Sit up a little bit more for me. Okay. Great. Okay. Take a big deep breath. Great. Okay, so if you could stand up and actually turn around, I'm going to do the same type of assessment, but on the front. Okay. Now, do you have any pain as I press?
No.
No? Okay, I'm just going to be listening to the front. So breathe slightly forward with your mouth open, deeper than normal. Okay?
Okay.
Okay. So thank you, Miles, for participating, and that concludes my skills demo number 1. Thanks.